Could an AI app actually be better than a doctor at diagnosing symptoms? Now on BBC World News, click. And you can join the conversation by using hashtag #BBCClick.
Can artificial intelligence outdiagnose a doctor? Can a phone bring a giraffe to life? And can this robot make this jump? Britain's National Health Service turns 70 this week, and it is struggling to keep up with the modern world. An increasing population who are living longer and who have evolving healthcare needs has led to not enough hospital beds, not enough access to specialised treatment, not enough nurses, and not enough doctors. The situation in developing countries is, of course, far worse. For a start, there's nowhere near as much money, but even where you do have money, you have the issue of the poaching of medical staff by richer nations. One hope is to plug the gap with artificial intelligence. IBM's Watson, for instance, fed with tons of data about cancer, may one day be better at diagnosing it than human doctors. And the hope is it will also be much cheaper.
I am your virtual medical assistant.
But more immediately, we're seeing the introduction of apps like San Francisco-based Sensely, which use AI to do a first diagnosis based on symptoms that we feed in. In other words, doing some of the work of a traditional GP. While some are sceptical that doctors can be replaced in this way, this week one company claims that its AI is now better than a doctor. Jane Copestake has been investigating.
Artificial intelligence has the potential to influence our lives in ways we can't yet understand. Nowhere more than in healthcare, where the decisions made by machines could be a matter of life and death.
Hi Alexa, I want to speak to Babylon.
Hello, Louise. How can I help you?
At an event this week in London, Babylon Health claimed its artificially intelligent software can now diagnose illnesses better than the average doctor.
I think I might know what's been causing your symptoms. It is most likely to be Meniere's disease.
Take the paracetamol that we can
The company has already launched GP at Hand with the NHS, providing remote access to medical services in London. But the only involvement of artificial intelligence here was an algorithm that runs you through a symptom checker. You would still talk to a human doctor for the diagnosis. Now Babylon says its software has reached a point where it can pass a medical exam with a higher average grade than a person.
What I found fascinating is that not only it performed as well as them, but in questions it had seen before, it had 98% accuracy. So once a machine learns something, it never forgets.
There are clear implications for this test for people in the world who don't have access to healthcare. Since 2016, Babylon had provided its healthcare service to Rwanda in Central Africa. Sub-Saharan Africa has 11% of the world's population, but carries a quarter of the world's disease burden and has just 3% of the world's medical staff. In Rwanda, the country faced a particular catastrophe with its healthcare system after suffering one of the worst atrocities in the last century. Over 800,000 people were killed in just 100 days in the genocide of 1994. This memorial in Kigali is the resting place for over 250,000 people who were killed in the areas surrounding the capital. The genocide touched nearly every person in Rwanda, decimating human resources. When the genocide ended, there were only 198 health professionals left for a population of over 6 million. It's difficult to overemphasize the challenges of rebuilding a society after such tragedy. But today, Rwanda is regarded as an economic success story in Africa. Its president, Paul Kagame, has invited tech companies to the country to test their ideas. First drones, and now artificial intelligence. We visited the offices of Babylon, called Babil in Rwanda, with the country's health minister. So the health minister is here to see a demonstration of how the AI triage works. The company already has 2 million registered users and has done thousands of consultations. Babil is using the same chatbot as its UK customers would use, but there are several differences here. Most people use feature phones, not smartphones, so the service is provided by a nurse who reads the text of the AI over the phone.
Hello, mwaramutse. Murakaza neza muri Babo Health.
This is a symptom checker, which would refer the patient to a human doctor. With long waiting times and long walks between homes and health centers, patients using the app can save a lot of time. After speaking to the nurse via the chatbot, Pacifique was able to pick up a prescription in about 10 minutes.
You see, this service is easy. You can use it at home and come to the hospital and they will see you immediately.
Babil have employed several methods to get the message out to the general population here. They hold rallies around markets all over the country and do a lot of on-the-street outreach. Many people we met were already signed up.
Oh, she's already registered.
Some even had appointments.
It's really good because sometimes you take a taxi and pay 6,000 Rwandan francs, and when you reach the hospital, you find the doctor's not there.
But for others, there are simple barriers stopping them using Babil.
I don't have a phone.
And on the chatbot, the government wants to see more country-specific data integrated into the software.
The artificial intelligence that is being tested here with Babil has been designed from the UK system. But as you know, public health issues are different in the UK and in Rwanda. For example, malaria. We didn't find any question related to malaria.
We need to give it some local context. So what we are actually doing is we are developing modules for those conditions that are not yet integrated into AI, like tuberculosis, HIV, maternal and child health, things that actually matter for our context.
Back in the UK, Babylon announced the results of its chatbot's performance on medical exams versus human doctors. They said its artificial intelligence achieved an average mark of 81% on its first attempt, versus 72% for a human. They calculated that average based on 5 years of medical exam results. But these claims have been met with skepticism by some senior doctors who question the timing of the release.
I wouldn't, with the research that I do,